is killing so many people? We have a worldwide problem that is killing millions of persons in the world. And this is a problem that it is occurring even before 2019. It's a huge amount of people dying every day. And do you know who can be the main responsible of this? Ourselves. Cardiovascular disease is the leading cause of death worldwide. And in most of the cases, this disease is caused by our own actions. If you want to know how to avoid cardiovascular disease in your life, keep watching. Hello guys, I'm Dr. Hernandez-Benitez and I'm a scientist. And today we are talking about cardiovascular diseases. But what are those cardiovascular diseases and why this is the main cause of death worldwide? First, we need to know that cardiovascular disease not only refers to those diseases affecting the heart, but also all diseases that affect the vessels that allow the blood circulation across the entire body. Thus, cardiovascular diseases can be classified or organized according either the location where they are located in the body or the origin or cause. If we are talking about location, we can find, for example, if the problem that causes the cardiovascular disease is located in the area of the heart, we are talking about coronary heart disease. But if it's affecting the blood circulation that travels from the heart to the brain, then we are talking about cerebrovascular disease. Finally, if the problem affects the circulation between the heart to our extremities or hands or foot, we are talking about peripheral diseases. By other side, we can consider those cardiovascular diseases according to the cause or origin of that disease. For example, if this is something that was originated when we were in development inside of our mother, we can talk about a congenital disease. However, the cardiovascular disease can be also caused or be a consequence of an infection. For example, there is a bacteria that causes the rheumatic fever, and one of the consequences of this rheumatic fever is an inflammation that can affect the heart and its blood circulation. Then we are talking about rheumatic heart diseases. And finally, the disease can be caused by a blockage in the blood flow circulation. And that blockage can also be caused either by a blood clot, this thickness, consistency in the blood that allows stop the blood flow when you get a cut and then you will not die from just a small cut. Then if that blood clot is formed inside in our vessels and eventually travels and can block, for example, the circulation into the lungs, that generates a big problem. Another type of blockage that is caused by fat, the fat accumulation inside of veins and arteries that causes a same blockage. Then we are having in general like an obstruction in this blood flow, origin for cardiovascular diseases. Then from all those diseases, where is the heart attack? Well, the heart attack is actually caused by this blockage in the blood flow circulation that goes into the heart. Usually, this blockage is caused by fat deposition inside of the vessels, and this generates an obstruction that blocks the blood flow into the heart. Then what happens? The heart, as an independent structure or tissue, stops to receiving the blood that it needs to nourish itself. That means that it stops to receive blood, it stops to receive oxygen and nutrients. And then some part of those cells that form the heart start dying. And depending on how intense is this stop of this blockage of flow of nutrients and oxygen, the part of the heart that is dying could be small and cause a heart attack in which you can survive. But if the blockage is too high and damage too much part of your heart, then it could be fatal and cause the death of the entire organ and thus the death of the entire person. But then why this blockage happens and why generates the heart attack at the end? So this is not something that is generated spontaneously from one day to another. The formation of that blockage requires some time. Could be some hereditary predisposition to this, However, most of the risk factors to generate this are purely behavioral. That means that our actions define the eventual appearance of that blockage inside of our vessels. That means that we are responsible of generate the heart attack in ourselves. Why we are responsible? By having an unhealthy diet, by having physical inactivity, by having tobacco use and alcohol abuse. More recently, stress has been included as a risk factor for having a heart attack. Sometimes we can be unaware of this. However, if we go to a clinic and our medical doctor can determine certain parameters like blood glucose, blood pressure, cholesterol levels, and also monitor our weight. And if those parameters are too high, that means that we are in more risk and probability of having a heart attack. Then what we can do to prevent a heart attack, having a healthy diet, and I know this is sometimes difficult, especially the current times. Sometimes we are in a rush and we don't take care or attention about what we are eating because we are in that rush. But think about it. Is actually that rush worth it? Sometimes when the heart attack happens, can change completely your life. And if you are a little bit aware in your daily habits of, okay, I can modify a small thing in my eating pattern and avoid a big problem in the future, it could be worth it. And having a healthy diet sometimes is cheaper. Let me know in your comments what you think about it. But yeah, I think sometimes it could be cheaper to have. Just we need a little bit of planning, and that is, I think, where the parting where many persons, including myself, we fail because we have a life that is in rush, and sometimes we took those foods that are more accessible without thinking about how healthy or unhealthy it is. Also, having physical activity. I mean, for me, for example, it's quite difficult to do a regular exercise, but being aware that we need to move ourselves, our body, and don't just be sitting in one single place is important and can make a difference. But trying to do regular exercise is something that can prevent a future heart attack. Tobacco use. I think now, for example, in countries like the United States and Mexico, many people is changing their mind about the smoking, especially tobacco, and the smell is quite bad. So many people is trying to avoid those persons that smoke just because the smell, and that also generates a cycle in which the other person stops smoking. So it's interesting that is happening this way, but also stop smoking is something that can avoid a heart attack. Finally, be aware in your drinking consumption, because drinking is more socially accepted than sometimes, and independently of the problem of alcoholism, sometimes it's socially accepted and it can generate patterns. So be aware and try to reduce as much as possible the alcohol consumption is something that can prevent a heart attack. So guys, I hope you learn about what is a cardiovascular disease, how we can prevent, what is the origin, and why we are the main responsible. And if you have any question, don't hesitate, contact me, and see you next time. Bye.